will have these things at the same time. So just give us any.
So thank you for that. I'm a chronic pain specialist. What I always say is, if you've had physical therapy before, just forget what you've done, what you've experienced. This is completely different. And so we help the most complex chronic pain sufferers out there. In fact, the more complex they are, the more excited I become. And the reason for that is usually those people don't have hope, and they're resigned to living in pain. And here I am seeing the potential of how their body looks and how I can correct them. So that's really where that's coming from. And so people always ask me, I want pain relief. How long is this going to last? That's the biggest fear you have, right? Is usually you have a little bit of pain and you just kind of ignore it because you think it will go away and it's not. But it doesn't. And the reason it doesn't is because you start to compensate, right? So if your right leg is hurting, then you start favoring the other leg. And so all of a sudden you have this look, and then it stays that way, and so you can no longer function the way you're supposed to. So anyway, when people come to me and they say, I want pain relief, I kind of joke about it and say, no you don't, right? Because how many people here have lived with pain for years, right? So we can live with pain. When people come to me, what they're truly asking is, I want to be able to sleep better at night. I want to be able to travel, socialize with my friends, play golf, play tennis. Those are really and truly what you're looking for, not pain relief. Otherwise, you can just pop a pill, right? So it's that deeper understanding of what truly people want. Our approach is giving you what you want. So we only use your pain as the guide to find the problem. But if you can't sleep, then our direction of treatment is to make you feel better and sleep through the night, okay? But whatever it is, any of those, if you want to be able to garden or play the piano, whatever it is, that is what you want, that's what we're gonna give you. So the question is, how can I accomplish that? I'm gonna give you a little bit of a backstory. That's my second daughter, her name is Jules, and she was born 3 months early, so she's my miracle baby, okay? So she was only 2 pounds, 15 ounces. And as a result of that, the doctors said that she had a brain bleed on day 1. So essentially she had a stroke. And any type of injury at birth is called cerebral palsy, right? And so one of the things that really changed the way I looked at a problem was when the doctor said, the injury has already happened. All you have to do is manage the consequence of it. And with that in mind, I analyzed her, and I felt that I cannot just blame the dysfunction on the brain, because that's already been done. But because of the limitations of what the injury was initially, there are some compensations along the way, and if I can only correct that, she can function better. And the proof that it can work is that is her right now. She's a junior in college, and she spent 3 months in Taiwan swimming with wild turtles and hiking some mountains. So she is that active. And so what that experience did to me was it changed the way I solve a problem, right? And so that led me to what I call the body recalibration method. And there's 2 ways of doing that. There's a fascial one and there's a muscular one. So you have to have the fascial one first. What does fascia mean? If you look at a piece of steak, it's the marbling or the gristle around it, right? So if you are, that fascia connects us all from head to toe, just like our skin. So imagine when you're compensating, right? You drag the fascia also. So here you are, after many years of compensation, you actually twist that fascia. So you think you have, your pain is because of bulging disc or bone and bone, when in fact, you are practically wearing a t-shirt and a pair of pants that's twisted. Now try functioning that way, okay? So when you understand that, and you correct that, you're going to realize that you can actually function better, okay? And of course, the second option is, you're like a Rubik's Cube that's all misaligned. and one muscle at a time, we can correct you, and that's the more permanent way of recalibrating you. So it's like getting to the root cause of the problem. Talking about the root cause, I want you to think about this. If any of you have pain, let's say it's a right hip, right? You go to the orthopedic doctor and they tell you that you have bone and bone, right? That's very common. So you just accept it. Oh, that explains why I have pain in my right hip. It's because it has bone and bone. But the one very important question that hardly anybody asks is, why is it my right hip that hurts? Why is it not my left? There is an explanation behind it, and that's the root cause of your problem. Okay, so here you are. That's the normal. And there's the lopsided body, right? So when you look at a body that looks like that, which is one shoulder lower than the other, you're going to see that the belly button is slightly off. You're going to feel that the hip is touching your hip one side, on the arm here, more than the other. Those little nuances, that matters to how you function. Sometimes if you march in place, you look at your feet, you're going to notice that one foot is actually turned out more than the other. That has absolutely nothing to do with your feet. It actually means that your pelvis, if your foot is turned outward, that means your pelvis is actually turned to the right. Now try walking like that, and you can really imagine how you abuse your body in different ways, right? And so the lopsidedness, that's a consequence. If you've ever had a failed surgery, back surgery, hip surgery, whatever orthopedic surgeries you've had, and if you blame the doctor for the residual pain or for the lack of success, I can tell you right now, I've been doing this for a long time, it is very rare that it is the doctor's fault. It is typically the fact that before you decided to go to surgery, you actually were compensating. All of a sudden you decide, okay, it's time for surgery. So now the hip or the knee are now functioning normally, right? So what happens when it functions normally? It's going to expect the rest of you to function normally. At that point, you can no longer do that. So in other words, if you just address that, you're going to find out that you're actually successful, and we see that a lot. So as I've mentioned previously, pain is our guide to find the problem, what you're missing out on. What you truly want is to be able to sleep better, walk with your dog, walk on the beach, travel, play with the grandkids. And the one thing that I hear often is that when the grandkids come to visit, they plan to go to Disney and they don't get invited because they slow the grandkids down. And so that is something that people don't really talk about, but it's important. So now imagine if you recalibrate the body and it can lessen your pain by 50 to 75%. Can you imagine what life would be like? Some patients can't even imagine that, and they look at me straight in the eye and say, I don't believe you, right? Because it is inconceivable sometimes when you've been living in pain for up to 30 years, right? So in order to calibrate the body, depending on how many problems you have, that literally takes 2.5 months. I know that sounds crazy, but it does happen. Because what does 2.5 months translate to? If you follow the protocol, that's 25 visits. That seems like a lot, but 25 visits means 25 hours of work. In other words, if you have 10 years, 5 years of pain, I'm telling you that it will take 25 hours to fix 5 or 10 years of pain. So when you look at it from that perspective, it's not so bad. All right, so here's an example of what we do, okay? So you can see here that there's a gap, right? So the hip is actually shifted. And a lot of people who look like this, they're gonna end up with a hip problem, okay? And if, for example, you hear of IT band syndrome, for example, if the IT band syndrome is on the left side, the worst thing that you can do is stretch it. Why? It's already overstretched. So you gotta know what you're doing, okay? Now on the other hand, if the IT band is on the other side, then that would be worth correcting and stretching. But you can see that looking at that initially, and we were able to correct the pelvis, and as you can see, this lady's wearing the same shirt, so it can happen in an hour. Okay? And here's another example. You can see that this lady actually had the trunk turn. Okay? One of the ways to notice, to find out if you have that problem is take your time to lean back, sitting on a chair, and try to feel the right side versus the left side. Can you feel that one side of you is touching the chair more than the other? And I want you to take the time to do the same when you're laying flat in bed. Split yourself in half and see if one side is actually touching the bed more than the other. That really tells you the asymmetries that you could be having, right? So just a little story on this one. This is a lady, Dr. Diaz actually sent this patient to me. Oh, there you are. And she was scheduled for neck surgery because she clearly had radiating pain down her arm. There was absolutely no doubt that there was a pinched nerve. Now, why was she able to cancel the surgery? Because when you understand it, if you are twisted this way, but you think you're looking straight, imagine what happens to your spine. It's actually twisted. What happens when it's twisted, you're going to pinch the hole where the nerve comes out. So by recalibrating the body, just like that, this lady is currently pain-free. So I just thought that I'd put it out there. If you want to speak with me, those are the choices. And most of my patients, by the way, are very skeptical because most of them have tried everything and nothing works. So I'm here for you if you have any questions.